Pan American Health Organization and the Government of Mexico through the Federal Commission for the Protection Against Sanitary Risks and the Ministry of Foreign Affairs cordially welcome you to the 11th Conference of the Pan American Network for Drug Regulatory Harmonization. And now we will introduce the members of our Presidium. Minister of Health, the Government of Mexico, Dr. Jorge Carlos Alcocer. Under Secretary for Multilateral Affairs and Human Rights, Ambassador Joel Hernández. Representative for the Pan American Health Organization and the World Health Organization at Mexico, Dr. Jose Moya. Federal Commissioner for Protection Against Sanitary Risks, Dr. Alejandro Schwartz. Director of the Innovation Department, Access to Medications and Sanitary Technologies, PAHO WHO, Judith Rios San Juan. Representative of the National Pharmaceutical Industry, General Manager of Leomont Laboratories, Alfredo Rimoch. Adjoint General Director of the General Direction from the European Commission, Dr. Martín Seychel. Also, we would like to welcome the representatives of the Latin America representation of the pharmaceutical industry and the Latin America Association of Pharmaceutical Industry, Janet, Gina, and Ruben Abete, respectively. Welcome again, lady ministers, vice ministers, and gentlemen ministers, vice minister, as well as representatives of 34 member countries of the Pan American Network for the Harmonization of Drug Regulatory. And also all of our special guests, be welcome, the directive body of the Ministry of Foreign Affairs, officials from the Federal Commission for Protection Against Sanitary Risk of PAHO, and all institutions joining us. To begin this inaugural ceremony, first, Judith Rios San Juan will address the room, Director, Department of Innovation, Access to Medicines and Health Technologies at PAHO WHO. Good morning. I am honored to welcome you to the 11th Conference of the Pan American Network for Drug Regulatory Harmonization. As Director of the Department of Innovation and Access to Medicines and Health Technologies at PAHO, it is a pleasure to open this relevant event for our organization and the region as well. Since 1999, this PANDRH network has been a beacon for the Americas, where we have worked to converge and strengthen regulatory systems and health technologies, an inclusive and innovative space that creates and facilitates bridges of communication that usually there are not in the organizations for the processes of the pharmaceutical industry, and that will help promote efforts to facilitate access to health technologies. This conference is paramount in several aspects. I would like to express my gratefulness to the government of Mexico, especially the Ministry of Foreign Affairs, the Ministry of Health, and the Federal Commission for the protection against sanitary risks for their hospitality and the summoning response. Today, we are gathering here regulatory entities and representatives of the industry, plus authorities of the top level of the member states of PAHO and strategic partners like the European Commission. We have prepared an agenda for these 3 days that will help us approach opportunities and challenges in different levels, strategies, and topics for the region. This conference, the agreements that we execute have the potential to transform the lives of millions of people. So let's contribute, all of us, to this with specific proposals and ambitious as well. Without further ado, I give the floor to the remaining officials that will speak in this event. Thank you. Thank you very much for your words. And now we'll have Dr. Jose Moya, representative of PAHO here in Mexico. Thank you very much. Good morning, ladies and gentlemen. As representative as the Pan American Health Organization and World Health Organization, I am happy to greet health ministers and vice presidents, chancellors, and representatives of the pharmaceutical industry. I would like to recognize especially the government of Mexico, represented by Chancellor Alicia Bárcena, Joel Hernández, the Secretary of Health, Dr. Alcocer, and Dr. Svarch from COFEPRIS. Your work has made this such a fluent meeting, and this is the first in-person meeting after the COVID-19 pandemics. I would like to greet the members of the Presidium and my colleagues at PAHO and WHO. Dear friends, I am happy to be here. Certainly this meeting will give us the opportunity to have technical cooperation with the different countries upon the agreements we have in this conference. We will retake the convergence agreement from the PANDRH network. This is in light of the new challenges our region faces to expand equitable access to health services. In occasion of the 25-year celebration of this network, I would like to underscore the pioneer role we have had in the cooperation of key sectors in the pharmaceutical environment, trying to find common ground, good practices, and regulations that will provide equal access to medications and services. The present presents challenges because we need efficient and integrated regulatory frameworks in health systems capable to regulate and supervise a series of health technologies, interest of the health systems, and have agile responses to any change in the matter of health. Plus, when national policy and the context allows for it, it is expected that regulatory systems can contribute to the development of industrial ecosystems, promoting social and economic development. Under the framework of challenges and opportunity, it is evident the need to strengthen harmonization in regulatory frameworks and strengthen the work of the network PAN to make this outcome a true. I hope that the result of this conference will help us perfect a roadmap to achieve these objectives. Please, let's renew our collective compromise for these endeavors. Thank you. Thank you for your works, Dr. Moya. And now we'll have a video from PAHO W. Is Dr. Jarbas Barbosa. Dear authorities from the region of the Americas and international authorities, dear representatives from the pharmaceutical industry, private sector institutions, and non-government organizations, and dear colleagues from the WHO and our organization, PAHO. I would like also to greet the Commissioner of COFEPRIS, Alejandro Svarj, who is coordinating with us this important meeting, and also Madam Chancellor Alicia Bárcena for her important support for this meeting. Welcome and thank you, everybody, ladies and gentlemen, for your participation in the 11th Conference of the Pan American Network for Drug Regulatory Harmonization in Mexico City. I also would like to thank the government of Mexico through the Ministry of Health and Ministry of Foreign Affairs and the Federal Commission for the Protection Against Sanitary Risk for their collaboration to lead and head this conference. Also, I would like to recognize the government of Canada and the European Commission for the support provided in the organization of this event in the region of the Americas. This new edition from the conference of the PANDRH network is singular for several reasons. On this occasion, we are celebrating 25 years of the PANDRH network, a pioneer network in the Americas, since its creation has contributed to regional cooperation around regulatory standards, good practices, as well as topics and specific technologies to improve regulatory capabilities in the region. Its relevance has resulted in the summoning of less usual actors, but strategic and political excellence to move forward these regionals. This network was formed in order to provide technical cooperation necessary in the Americas in the regulatory challenge and adopt new policies to guarantee access to safe, efficacious, and of quality medication, recognizing regional asymmetries. This mandate is valid more today than ever. During these years, some of the achievements, much have been the achievements of the PANDRH network, beginning by the conferences conclusions that had been translated into initiatives that regulatory national authorities have promoted with the support of the Secretary of PAHO and the collaboration of member countries of the network. As well, it has been hard work from the technical working groups with the production of documents and recommendations to be implemented. Another important aspect of the technical cooperation has been in the training of strategic topics in the regulatory agenda. It has gone through strategic review processes, adapting priorities, objectives, and government mechanisms. During this process of regular building and for the promotion of the regulatory efficiency, regulatory national authorities have had bilateral and multilateral agreements to share information and cooperate on several actions. An example of this has been the use of regulatory decisions from other jurisdictions for the authorizations of emergency use for the direct access to 25 member states from PAHO to evaluations of COVID-19 vaccines from the list at WHO. This is a good time to recognize progress, contributions, and the evolution of this regional initiative in the first quarter of century, but perhaps it is more a hallmark to reflect collectively on the future of the PANDRH network so we could have specific and timely responses before the new challenges and the access asymmetries to persistent health technologies in the Americas. We are celebrating the first in-presence conference since COVID-19 pandemics, giving us the opportunity to reflect together on the status of application at a regional level of the learnings and practices obtained after the emergency in such a way that we will be better prepared and ready as a region to answer to other threats. Y ahora permítanme continuar.
recent mandates from PAHO member states to strengthen regulatory systems and to increase the capacity for innovation in the production of medicines, vaccines, and other health technologies at the regional level, with a view to improving their equitable access. These mandates call for the redoubling of efforts to strengthen, harmonize, and converge regulations as essential pillars for the advancement of their objectives. This network is the natural space to prioritize and lead the development of practical and tangible contributions to regulatory cooperation and convergence in support of policies to strengthen regional regulatory systems and productive capacity with the ultimate goal of improving equity in access. We have an opportunity to generate enabling environments and regulatory ecosystems that consider the full cycle of medical products. This is a crucial moment for the Americas to promote public policies that integrate all these dimensions in support of our efforts to ensure the health and well-being for the people of the region. I do not want to fail to mention the very relevant challenges and new frontiers in regulatory science that will be discussed at this conference, such as the linkage between regulatory functions, access, and production diversification strategy, regulation of medical devices, regulatory digitalization, and the incorporation of artificial intelligence in technological innovation and in regulatory decision-making. These topics will be discussed over the next days, and the recommendations made will set a path for the future direction of the Americas that must be addressed. We know that in a globalized medical products market with significant innovation and access gaps, strong regulatory systems and the harmonization of regulatory standards can minimize barriers to accessing medical products, including vaccines, medical devices, and other strategic health technologies. Through strengthened and efficient systems based on good regulatory practices that promote the adoption and harmonized standards and the use of decisions from other jurisdictions, we can promote equitable access to safe, effective, and quality health technologies, both in routine situations and in public health emergencies. A healthy regulatory environment aligned with international standards, a coherent regulatory environment between the health sector and the science and technology, industry and commerce sectors, which responds to the needs and objectives of health systems, is also essential to create an ecosystem that fosters research, innovation, technology transfer, and the production of quality raw materials and health technology. It is time to strengthen the enabling environment for dialogue offered by the network between regulators, the regulated sector, and other relevant stakeholders on these areas, as well as others that may require a greater intervention to advance common standards and best practices at the regional level, aimed at promoting equitable access, health, well-being, as well as economic and social development. In closing, I wish you a productive conference in Mexico City. May the three-day event provide an opportunity to celebrate achievements, exchange perspectives, renew and reinvigorate regional and global cooperation, and strengthen the activities of the Pan-American Network for Drug Regulatory Harmonization. On behalf of PAHO, I reiterate my recognition, support, and encouragement of these efforts and reaffirm the commitment of our organization to the mission and the strengthening of the Pan-American Network for Drug Regulatory Harmonization and to the reinforcement of the regulatory capacity of the region of the Americas. Thank you very much. Muchas gracias. Muito obrigado.
Thank you. Thank you, Dr. Barbosa, for your message. Before moving on to our next speakers, we would like to greet Mr. Itisilo, head of the Regulation and Safety Unit from the World Health Organization. Welcome. And now we will hear the representative from the national pharmaceutical industry, Alfredo Rimoch Liebenberg. Good morning, everybody. Secretary of Health, Dr. Jorge Alcocer, Commissioner of COFEPRIS, Dr. Alejandro Svarch, Dr. Jose Moya, representative of PAHO, Mexico, Madam Judith Rios San Juan, Director from the Department of Innovation at PAHO, directors of regulatory health agencies, distinguished members of the network part, and colleagues. I am deeply honored to be here addressing you in such a significant event. We are gathered here today to reflect upon the challenges and opportunities our region faces in the quest for a regulatory harmonization that will guarantee a fair and equitable access to safe and quality medications. In these lines, I would like to share with you an experience that shows what we can achieve when we work together towards a common objective. In 2020, we face one of the greatest challenges in our lives, a pandemic that deeply impacted us. At Leomont, we had just opened a plant of recombinant vaccines, and we were pinpointed as potential manufacturers for the AstraZeneca vaccine licensed from the University of Oxford, and all within a non-profit environment to face the health emergency in front of us. Since then, we worked tirelessly to close the gaps and make a reality as the regional production of this vaccine to save as many lives as we could. Our collaboration with AstraZeneca, represented here by Julio Ordaz, his director in Mexico, was critical. But what really helped us move the mountains was the extraordinary alignment of wills amongst all the stakeholders. In this way, we manufacture in a matter of months close to 100 million doses for the region. Without a vaccine that was produced in the region, Latin America would have been left behind in the crisis response. This effort linked the Chancellorship of Mexico, COFEPRIS, other stakeholders, the airlines that would transport the inputs, embassies, and all the actors in the region that were key to guarantee safety and quality deserved by our citizens.
I know that we face technological challenges and logistic challenges that were just cumbersome, that were just immense. What was valuable was the lessons learned. When we simplified all the processes and when we concentrated and focused our energy on that shared dream, then we were capable of overcoming any hindrance, any obstacle. All of us, all the entities involved back then had one desire, one wish fulfillment: find a solution to a problem that seemed to be a problem that we could not overcome. I want to express my sincere thankfulness to all the stakeholders, the collective that made this possible, including the Ministry of Foreign Affairs, the Ministry or the Commission for Sanitary Risk, the Healthcare Ministry. There were risks. We took them on head on. Things happened, things continued flowing amidst that situation, and there's things that are left clear. We were prepared. Preparedness and opportunity simply were connected, and we achieved what many thought was unachievable. We must be prepared for what's to come, and I invite you to really be mindful about this past experience, because we tend to forget how vulnerable we are when the emergency is right there happening. Harmonizing regulations, developing technological infrastructure, generating partnerships between the academia, industry, and government are essential for our self-sufficiency. This is a great opportunity. Let's take the opportunity now. We have people from CEPI, the Pan American Health Organization, or PAHO. Delegates are present, and all of you are government and regional agency representatives present with the same will. Let's take the opportunity. Let's not let it pass. Thank you for your full attention. Thank you so much for that kind announcement. Now we'll continue and we'll invite the Federal Commissioner from the Commission of Protection Against Sanitary Risk, Mr. Sparch Perez, is going to take the floor. Good morning, everyone. Mr. Alcocer, with your permission, I congratulate and greet Jose Moya Medina, doctor, here representative from PAHO and World Health Organization in our country. Thank you for being a representative. We thank Judith Rio San Juan, Director of Innovation and Access to Medication and Technologies from the Federal Commission and PAHO. We thank Alfredo Rimosh, representative of the pharmaceutical industry at a national scale. We thank Mr. Joel Hernandez Garcia, Undersecretary for Multilateral Affairs and Human Rights. And I thank my professor, Jorge Alcocer Varela, the representative of the Ministry of Health in the Mexican government. He's the intellectual author of the conference that's hosted in this nation today. Thank you for being enabling us to be in this conference, Mr. Alcocer. There's many representatives of the pharmaceutical industry and international agencies. I greatly thank my counterparts, all the members and all the delegates of the PARF network, the international observers. I thank the Secretariat of the PARF network. I'm here to also greet all our distinguished ministers of health, the chancellors, vice chancellors, and other authorities that are present in this crucial, important event. Thank you all because I consider you all my friends. Welcome to this country, Mexico. And on behalf of the Ministry of Health and the Commission Against Sanitary Risks, the federal commissions here, we welcome and we host you to this great country. It's an honor. It's a valuable opportunity that we all have to be part of the network and to be part of the celebrated 11th edition of the harmonization to really regulate the pharmaceutical industry in Pan America. Without doubt, after the sanitary risk that we all lived through in COVID-19, we as countries have defined to be present, representing our nations. We have to modify the process in which we regulate the pharmaceutical industry. We all know that we must cooperate at an international scale, and that cooperation anchored us, and we gave immediate response and paid immediate attention to the pandemic and what happened. It's not just out of just simply, it's not casual. We're here celebrating this international conference with the authorities, ministries of foreign affairs, health organizations of our nations. So I thank the Chancellor's Unit with Ms. Alicia Bárcenas. I thank Daniel Ayurico and the whole team. I thank the collective of the Chancellor's Unit. It's been an honor to work with you to drive forward all the pharmaceutical regulations at a continental scale. Likewise, I must acknowledge the full support of the Pan American Health Organization of PAHO. Judith, thank you, ma'am. Begoña, Maria Luz, your team has been great. Thank you for your hard work. Thank you for coordinating your efforts for us to materialize this 11th edition of the Pan American Conference. Thank you, Judith. I thank the Federal Commission of the Sanitary Risks. I thank Pablo Quiroga, Daniel Rosales for administrating and following up on things. I thank the international operations teams of the Commission, Maine, Margarita Contreras. Thank you so much for being part. Thank you for developing content. And Mr. Isaac Nassif and the Social Communications Unit of this government is always here giving its best and making it happen. We're convinced about the fact that it's extremely important to work with strategies. In this conference, we want to revitalize a PARF network. We must focus on giving it life. There's 3 immediate actions that are very specific. First, regulation. Aligning and harmonizing the laws and regulations is top, based on scientific fact, to develop and for it to be implemented in the medical field. This gives us the opportunity to really find a way to regulate that to generate trust that enables us to work faster and to have access to medical units and medications and aid other health organizations as counterparts. After COVID, we needed efficient, immediate access to medications for the responsiveness, the sanitary health risks. We need to tighten the collective efforts. We need to work together as government agencies, as sister and brother entities. We have to build trust. Trust is built based on findings, focusing on joint endeavors, opening to dialogue and mutual understanding. Let's not go through double efforts to regulate. Let's simplify requirements. Let's reduce costs. Let's cut down costs. And let's also cut down the use of time. As our poets would say, in a world post-COVID, the participation of America and the participation of our economies lead us to listen to our voices and regulate this it is vital yearly. We must, or could say that it's necessary day after day. We wake up every day in a different world. In the majority, most of us in this world need to get or must have the opportunity to get the best out of the both worlds and understand antique ideas that are not serving us to change realities. This takes me or leads me to the second point of mindfulness today, the production of medication or drugs. This is a shared event. We're working with the public and private sectors. This gives us a joint opportunity to overcome any tensions. Think about the logic, economics, and sanitary risks. Let's build this together to keep our countries. Let's build regulations and strategies to govern our states and so we can protect our families and communities. Health is a social, it's a right. So governments must establish the regulations to participate between the private and public stakeholders to benefit the collective humanity in synergy, the national healthcare systems, the economists, the stakeholders must have a shared mission and vision. Let's prioritize. Let's understand what's the mission and the vision. Let's really make it for our region. Without the baseline, these grounds, we could never imagine having access to all these medications at a universal scale in our region. It has to be universal. We need to transform our governments. The governments are not just administrators. We're not just regulators. We're not entities that provide. We have to allocate budget to develop and protect due to sanitary risks. But let me tell you also, governments have to be entities to strengthen and regulate and harmonize the pharmaceutical laws that make it material so we can really produce medications that are safe, that lead us to work with efficiency, that are top quality, that all the population should have access to. Third point to be mindful about, access to products from the healthcare field for health. The awakening of America now leads us to analyze challenges that exist at an international scale. If we regulate the pharmaceutical industry, we monitor, we audit, we control medications and what's object of production. Jara Talit left it clear. A market without the rule of law leads us to the black market. The current dynamism of the state will lead us to really drive this movement forward. We don't want catastrophic situations. We want to benefit the citizenship and their families. Having access to medications is a social right. So we have to foster research. We have to foster development. We have to foster production. We have to audit ourselves. We have to really understand what's happening with trade and be auditing what's happening in the pharma fields. It's imperative to face the challenges head on with congruent efforts to finally have a universal coverage of medications and sustainable financial capacity to protect our health. Apart from COVID-19, we must have timely access under the principle of fairness, and that's medications that are safe and of top quality for us and for all. It's an objective, and that leads us to regulate the pharmaceutical entities. PARF, it's a network. It gives us room in proactive realms to really be developers. Let's sit down and identify common points, common goals. Let's draft the roadmap. Let's frame things and land our priorities so all our economies can participate. Let's draft that in these 3 days of activity so we can all contribute. It's very important to revitalize, give new life to the PARF network. I thank you for listening, and wholeheartedly thank you for enabling me to take the floor I'm here supporting the Federal Commission of Sanitary Risks and other healthcare authorities. We're here to overcome any troubles, and we're here to protect the Pan American people's health. The 11th edition of the Conference for Pan America has in mind the creation of the regulation, production, and access. The history that's going to be told here is going to be shared to all this nation, to Mexico, and to all our region. The questions that will be prompted throughout these days need to be aligned, solid. We need to give answers to the questions that are going to be posed. Let's not forget at the end of it, the medications are going to be applied or used on humans, on a family, on our counterparts in our communities. So what's developed should be created to protect the citizenship, humanity, and these medications should be available and spread everywhere. Let's harmonize our regulation of the pharmaceutical industry in America. Thank you very much. Thank you, Dr. Svarch, for your words. We'll continue. Let's listen to the participation of the representative of the Ministry of Health of the Mexican government, Jorge Carlos Alcocer Varela. I greet and congratulate each and every one of you, members of the Presidium, and we thank all of you who have been part of this great conference. This morning, we are here. We've been summoned by a collective objective, the health of our people and the health of our region. I go back in my memories, in my memoirs, I think about one of our patriots, Jose Maria Morelos en Pavon. As you well know in our history, he declared a document that's called the Declaration of the Feelings of this Nation. It's a very important declaration from Pavon that proves in that instrument how Morelos comprehended the national struggles. Pavon understood the meaning of the process of independence in this nation and the way in which our societies are organized and how our country is created. The landscape that will be part of the discussion in this conference leads us to observe reality, a reality that we have to work on firmly as a region. We know that there's fragmentation or compartmentalization in the healthcare system, and there's a lack of sufficiency in the healthcare area at a regional scale. As representatives of government, secretaries, representatives of ministries, and entities of health, we've been appointed to be leading the healthcare efforts to develop medications and other assets, because we will most likely face another pandemic or another healthcare risk as we faced during COVID-19, without doubt. It's going to happen. I'm not going to say more. Our mandate is to take care of the environment, and that mandate is everyone's mandate. How could we be self-sufficient at a regional scale to face any healthcare risk? At this time, there's 4 pillars, 4 core themes that have been submitted by Dr. Svarch, and you've heard the 4 pillars that have been submitted by other counterparts that are celebrating this 11th conference of the PARF network. We're working on harmonizing, regulating, researching, and creating production. Now, from the get-go, the regulations harmonization is a crucial step to be self-sufficient and to face any sanitary risk. That's the axis. That's the backbone of the PARF network. You might ask yourselves, what's the harmonization of regulations amidst the frame of this 11th conference in Pan America? I must say, when we were thinking about the unrationalized use of medications, the harmonization was submitted as a proposal, as an initiative to find points in which our regulations converge amongst economies at a regional scale. This harmonization leads us to respect the healthcare policies of each country. Now, what does this harmonization impact in America? Let's understand it thoroughly. We must fall back to history. Let's recall 2 important moments that really did shake the bedrocks of all the healthcare systems that I discussed, that I mentioned, at a global and regional scale. First, the first point, and what I consider a disgrace, was the fact that health was seen as a good that could be traded. It really eliminated the principal pillars that hold public health as a protection, as a part of the clear protection of our populations. Second, amidst the pandemic, based on experience after COVID-19, we all suffered the terrible consequences of the trades and the corruption of the all the tiers of the healthcare entities when some were trying to have access to medications that were of top need. When we harmonize regulations and find meeting points or points in which we converge, we can really frame what's happening in pharma and protect the healthcare systems. We have to draft and legislate at a national scale to ease down the worry and to really protect the health of our citizenship. Without doubt, it's a very complex job. But after these years, we've worked collectively to make it an immediate reality. We're harmonizing this for a region. Let's all remember that things that are easy are things that we cannot trust. Amidst the context, it is essential for regulating entities, regulators, which are authorities, to be properly trained. This is the time. It's now. Let's drive this movement forward, these initiatives forward. Technically, you have to be trained. You know, there's regulations. If we think about IT or technological innovations and human resources and material resources, we have to be all ready to really face on all the challenges that the economies are going to face. So, too, we need to drive forward all our innovations with research. We have to continue developing and strengthening our capacities, our capabilities to produce our medications at a regional and Pan-American scale. Let's work together with all our sectors. Let's focus on these multidisciplinary actions. And last but not least important, I must fall back to one point that strengthens us. Let's open ourselves to real dialogue. Let's coordinate and with our multiple sectors, with our multiple tiers, with the members and stakeholders of the PARF network, with the ministries of health, with the ministries of economy, with the sectors of the industry. Without doubt, if we take steps forward, we will have a positive impact on the structures, building strategies for the healthcare systems. The healthcare systems are the entities that protect the citizenship, that admit our patients in our countries. Let's work for America. Let's move forward. Let's work together. Let's converge as individuals, and we should all contribute to build a stronger America. Let's build the health of our citizens. Thank you so much. Thank you very much, Mr. Secretary, for your words, for your message. Now we'll continue and we'll stream a message of the representative of the Ministry of Foreign Affairs of the Mexican government, Bárcenas Ibarra. Thank you. This is streamed thanks to the opening celebration of the 11th conference of the Pan American activity. Moya Modina, dearest Jose, you're representing the Pan American Associations in Mexico. Dearest Jorge Alcocer Varela, Secretary of Health. Dearest Alejandro Svarch Perez, Doctor, you're the Federal Commissioner for the Protection Against Sanitary Risks in this country. Distinguished guest, and Martin Seychelles, Joint General Director of the International European Commission. Engineer Rimoch Lewenberg. He is the CEO of Leamont Laboratories. Janet Jena, Executive Director of the LATAM Federation of the Pharmaceutical Industry. Ruben Abete, General Secretary of the LATAM Association or Cluster of Industries. We thank the Technical Secretariat of the PARF Network. Thank you, dearest colleagues. Thank you, government officials, ministers, vice ministers, and LATAM representatives and Caribbean authorities, leads of national regulators. We thank the representatives of the different stakeholders and industries and agencies of the pharmaceutical industry at a continental scale. I want to greet you with this message. I apologize for not being there in person, but I'm pleased to direct this message or these few words amidst the 11th conference for Pan America to harmonize laws and regulations for the pharmaceutical industry, PARF. We start this conference that enables us to share best practices and discuss new ideas. And amidst this debate, we can find ways to move forward, to regulate and harmonize, to really have timely access universally to medications that are top quality at a regional scale. Amidst the pandemic with COVID-19 happening, that left it clear and evident to us that it had no precedent. And what we faced in LATAM and the Caribbean was that sanitary risks affected our economy, our societies. Our region was highly impacted, terribly impacted, and we faced a humanitarian crisis without precedent. We had an 8.4% of the population affected here, and at the end of 2021, we had the spread of COVID was 21.1%, and 32% of those who were suffering the condition were deceased. We need to coordinate and work together to provide an immediate response that satisfies the citizenship under the principle of fairness. We have to face the future pandemics. That's why I celebrate the 11th edition of the Pan American Conference. Let's work in synergy. Let's cooperate amidst economies. Let's work with all our companies to strengthen and to have an integrated capacity to provide fair access to drugs and medications amid any healthcare risk that our communities and citizens might face. During the next 3 days, we will share a specific glance, the whole view, and we'll share our best practices and experiences. We're going to be highly analytical with the strategies. We'll build mechanisms to accelerate the clear integration amongst our countries. We're going to do this. It all will converge, and we're celebrating the 25th year of the PARF network that's leading the effort to harmonize the creation of laws and regulations for the pharma industry. This network has been basic since 1999. We work in PARF restlessly to strengthen with all our regulations, our systems in America, with our perspectives and different experiences. We have a clear sense of responsibility, and we must build this with the clear elements that are crucial for strengthening our institutions. We have to harmonize our legislation and converge. We have to develop different disciplines, science-based experts, to clearly also solidify the pharmaceutical efforts. All of this to continue developing better technologies and treatments, which are part of this clear agenda. We're going to continue building history that will transcend. We are here the beacon that could give us guidance amidst this dialogue. Without doubt, we have to be sufficient amidst a sanitary crisis. We have 7 lines of action since 2021 that are long-term missions. And as I highlighted, we have to build these missions with strategy, integrate our efforts at a regional scale with our countries working together. We have to enhance our production capacity and self-sufficiency. It's necessary, so we're prepared to face future sanitary emergencies. We have to really work together, cooperate between stakeholders, whether you're public or private. It's necessary. It's imperative because the pharma industry in Latam in America is one that holds that great potential at a global level. Not only are we talking about medical equipment and medications, we're going to protect millions in our population. We have forecasted that we're going to have a 7.2% since 2021 and 2026. So our region will grow greatly throughout this 6-year administration. We're here to consolidate and harmonize our laws and regulations in the pharma industry. And in this conference gives us us the opportunity to align our national, regional programs along with the works of the PARC network. Let's optimize our resources. Let's optimize results. Without doubt, this time gives us the capacity to work in LATAM, in the Caribbean, and integrate these efforts. Let's work shoulder to shoulder. As Mr. Carlos Monsivais, this great Mexican thinker, used to say, he said, the first and last subjects that our LATAM Caribbean nations must do to find the day of light is that fight against the lack of equity. So that's why I'm voting here to really unveil and shed some light on these efforts so we can progress together and define clear priorities, common objectives that enable us to integrate the effort better. Thank you very much. Thank you. We thank our counselor, Varsenas, for the kind stream message. After her participation, we're celebrating formally the opening of the 11th Pan American Conference for Harmonization of Pan American Network and Drug Regulatory Harmonization. Now we'll continue with a brief pause, with a brief break, so we can enable some of our colleagues exit the press and print, and colleagues from the media are going to exit first. Thank you for your full support. Thank you for being present. Thank you for participating. Thank you for being here with us during the whole event.